At a food bank in West Allis, Wisconsin last year, volunteers heard from seniors facing a harrowing dilemma.
Should I pay for my prescription medication or should I eat?
You're on a fixed budget?
Oh, yeah.
Like 49 million Americans, 76-year-old Dennis Kopp receives his prescription drugs through Medicare.
I take 10 pills in the morning and I take 6 pills at night. One pill, they wanted $2,700 for 3 months, and I just can't do that.
So what'd you do?
Didn't take it. Can't afford it.
And what was that pill for?
For diabetes.
But there's a new program passed as part of the Inflation Reduction Act last year that will allow Medicare for the first time to negotiate lower drug prices. In Washington, Vice President Kamala Harris touted the new program, which allows Medicare to cut better deals with pharmaceutical companies.
So we are here today with the firm belief that in the United States of America, no senior should ever have to choose between whether they are able to fill a prescription or fill their refrigerator with food.
So how did we get here? Here's how the cost of pharmaceutical drugs has risen. As a result, spending on medicines has skyrocketed. Between 2002 and 2021, the amount Americans shelled out for pharmaceuticals almost tripled. According to Kaiser Family Foundation polling, 60% of Americans say prescription drugs have made people's lives better, but 79% say their costs are, quote, unreasonable. And 82% of senior citizens say the government should negotiate with drug companies to get a lower price for Medicare patients. So why is this happening now?
Before 2003, Medicare actually didn't cover prescription drugs at all. And as part of the 2003 Medicare reforms, prescription drug coverage was added for the first time.
Health law professor Nicholas Bagley teaches at the University of Michigan. He says Republicans resisted the negotiation part.
The idea from Democrats was that Medicare ought to be able to use its immense bargaining power, its immense leverage, to get a good price for drugs on behalf of the American taxpayer. But that wasn't the way the legislation was drafted, and it's been a bone of contention ever since.
Until Joe Manchin, a key centrist Democratic senator from West Virginia, took on the issue.
There is a bipartisan consensus that's going around right now, wondering how this can be challenged and how we can basically bring these prices down.
Last year, Manchin joined President Biden to pass the $2 trillion Inflation Reduction Act. That bill included a price cap for insulin, a $2,000 cap on the yearly spending Medicare recipients can pay for drugs, rebates to reduce the impact of inflation, and Medicare's new negotiating power.
This year, the American people won, and Big Pharma lost.
Here's how it's going to work. So Medicare is going to select each year a list of drugs that will be subject to price negotiation. The first year, which will begin in 2026, the manufacturers are told, hey, you need to come and sit down with Medicare in order to negotiate a maximum fair price for your drug. And if you don't, you're going to face either an immense excise tax on sales of that drug, or you can choose just to leave the Medicare and Medicaid program altogether.
Here are the first 10 drugs that will be subject to price negotiations, announced in late August by the government. The list includes blockbuster medications for blood clots, diabetes, and heart failure, serving roughly 10 million Medicare patients, unless the pharmaceutical industry wins in court.
To date, we have 8 lawsuits that have been filed, and they've been filed both by individual drug manufacturers and by consortia, including the Chamber of Commerce and Pharma, the trade group for the pharmaceutical industry. The basic argument that the drug manufacturers are making is that they're being coerced into participating in this drug negotiation scheme. They say that violates any number of constitutional provisions. The problem with all of these claims is that the law is quite clear that private companies, private physicians, private hospitals, they get to make a choice about whether to participate in Medicare and Medicaid. And if they don't want to, they can walk away.
The Congressional Budget Office estimates if the program survives the legal challenges, it will reduce the federal budget deficit by $129 billion by 2031. And it could have a big impact in the living rooms of millions of seniors, too. Clayton Sandell, Scripps News.